And welcome to our virtual event, Racism, Intolerance, and the Coronavirus, hosted by the German Marshall Fund of the United States. My name is Engy Abdelkader, and I'll be serving as the program moderator today. We're pleased to have you join us. As many of you are aware, the coronavirus crisis has disproportionately impacted racial, ethnic, and religious minority communities on both sides of the Atlantic. The crisis has not only highlighted social and economic inequalities facing these groups, but it has also exacerbated institutional, interpersonal, as well as structural discrimination confronting diverse minority communities. To help us identify emerging trends and discuss practical policy solutions, we've assembled a panel of experts, including community leaders, scholars, and policymakers, to ensure a more equitable tomorrow for all of us. Before beginning what is sure to be an engaging conversation with our experts, I'd like to take a moment to express a debt of gratitude to all those who made this program possible. Specifically, we are grateful to GMF's leadership program for hosting our conversation today. We're also thankful for the institutional support of our partners within the German Marshall Fund, including the Congressional Affairs Program, the Europe Program, as well as the Alliance for Securing Democracy. Last, and perhaps most importantly, I would be remiss if I did not acknowledge the tremendous efforts of my colleague, Crystal Bott, without whose logistical support, this conversation would not be possible. Thank you, Crystal. Just a reminder, this program is designed to be interactive and conversation-like. To that end, we remind our listeners that you do have the opportunity to pose any questions to each of our speakers throughout the webinar. Simply use the Q&A icon that appears at the bottom of the Zoom screen to do so. We will be monitoring your responses closely. Without further delay, let's begin. We're thrilled to be joined by Reta Jo Lewis, an attorney, former diplomat, as well as the director of the Congressional Affairs Program at the German Marshall Fund of the United States. Welcome, Reta Jo.
Unmute. Thank you so much, Engy. It is so exciting to be here with all of you this morning. We are very delighted that the Congresswoman, Congresswoman Haaland, has agreed to join GMF again. We thank you for participating this morning. This conversation is, we hope, continue, as Engy said, give you a perspective on racism and inequality in the context of the COVID-19 pandemic. And so for those of you, let me just give just a little bit of introduction on such a great biography from our Congresswoman and all the work that she has been doing. She's the vice chair of the House Committee on Natural Resources and the chair of the subcommittee on its national parks, forests, and public lands. Currently, she's a member of the Committee on Armed Services and holds multiple leadership roles in just numerous of caucuses that range anything from inequality, Native Americans, Task Force on Poverty, and others. It's important to point out that she is one of the deputy whips in the Congressional Progressive Caucus. And so it gives her, in this conversation, we believe, a leading voice on how the pandemic has affected minority communities and people of color. In May, I'm sure she's going to talk about the legislation that she sponsored with COVID-19, especially Disaster in Indian Country Act. She also has been very instrumental in public security and public law legislation as it relates to public health for Native Americans. And right now, what we want to do, Congresswoman, is to say welcome and start the conversation. And with that, I would like to kind of like throw out one of the first questions. You know, as a Democratic representative of New Mexico, you've always emphasized the importance of climate change, universal health care, and immigration. Tell us a little bit about how has the current crisis highlighting the urgencies of these items on the agenda.
Thank you so much, Reta Jo, and hello, everyone. Thank you so much for inviting me here today to share in this discussion on racism and social inequity that has unfortunately become accentuated with the onset of this terrible pandemic. The upcoming presidential election is also important, and the horrific murders of George Floyd, Breonna Taylor, and countless others. It's an honor to be here with the German Marshall Fund and with some other amazing panelists today. I'm grateful for the important work you do, and of course, always appreciate the opportunity to work with Reta Jo Lewis anytime I can. And thank you, Reta Jo. I appreciate the warm introduction. I am, just a little bit about myself before I launch into the question. I'm a single mom. I'm a 35th generation New Mexican. I'm an enrolled member of the Pueblo of Laguna. On my grandfather's side, he was from he is a descendant of the Pecos Pueblo, as am I, and which is now the Jemez Pueblo. As a Pueblo woman, I understand what it means to be part of a marginalized group that has historically lacked a platform to have a voice on systemic racism and social inequity. Where my family is from in New Mexico, and where many Native families in Indian country are originally from, is a rural location that lacks access to basic resources like running water, electricity, or luxuries like phone or internet services. And so this goes along with the question you asked, Reta Jo. Yes, the pandemic has hit our communities specifically hard because we start so far behind the starting line. If you've ever run a marathon before, you know, if you're way in the back, it takes you, 30 minutes to actually get past the start line to start running in the race. And that's kind of how I see Indian country. We've been underfunded drastically for decades and decades. And so when you pile a pandemic on top of that, on top of people who don't have running water, who don't have electricity, who don't have broadband internet services, who have been victims of the pollution from extractive industries for so long, it is not surprising that this pandemic has taken a hold of so many Native communities and not let go. You might have seen in the news that the Navajo Nation has one of the highest rates per capita of the coronavirus of even New York or New Jersey. And so, we know that these infrastructure and budgetary disparities, they stem from systemic poverty that was built into the American governance system, which, as we all know, wasn't created for communities of color, and that includes Native Americans. So we're doing everything we can in Congress right now to make sure that we are paying attention to what is needed to help people to survive this pandemic, to find success, and to lead more prosperous lives.
You know, Congresswoman, having been a vocal critic of the administration's response, can you kind of give us a little picture of what do you think should be prioritized in the federal response to the pandemic, especially as it relates to people of color and Native American communities?
Well, there's many things, but I'll start with one that myself and my Native sister, Sharice Davids, and the Tri-Caucus, we are part of the, you could call us the Quad Caucus now, the African American, Asian American, Hispanic American, and Native American caucus chairs. We get together and we talk about these things. One of the main things that needs to happen is the disaggregation of data. You might see that when you look at these tables and graphs and numbers, the data doesn't show a true picture. Sometimes they'll bunch all of us together and put us as other. And when you do that, it's difficult to know where to send the resources. And that's one of the big issues. We are working on that. I'd also like to say that we Congress appropriated $8 billion in the CARES Act, and originally the president did not want to give tribes anything. We said 20 billion, the White House said 0. We said 15, the White House said 3. We ended up with $8 billion to tribes, and then the administration essentially bungled that, the dispersion or disbursement, I should say, of funds to tribes. And so some tribes still haven't received the money that they could use right now to fight this pandemic. So if we think about communities of color all over the country, communities of color are the ones without the health care they need, without the infrastructure they need, without the resources they need for their students to continue learning online, for them to use telehealth medicine because of the lack of broadband internet, and so many other issues. And so those are some of the things that, yes, we're absolutely working on. We need to find solutions, and we need them now.
And I know, Congresswoman, you had a special message that you also wanted to give our audience this morning. Do you want to go forth with that?
When I think about what needs to be done, there's several things. One is everyone needs to answer the census. We absolutely need to make sure that we're answering the census. That is one of the most critical things right now that everyone needs to do. We do that because we need to make sure that Congress appropriates the funding that our folks need. Additionally, we absolutely need to make sure that everyone is voting. This is, everyone has the opportunity to show the country that we are involved, that we're still here, and that the upcoming 2020 presidential election and the census count matters, because every vote matters and every voice matters. And so that's what I will say for now. And thank you, Reta Jo.
You know, I know that you have seen some big lessons learned from this current crisis. Do you want to talk to our audience about some of the things that you've definitely seen and observed, and things that you have learned from your other colleagues about best practices around the COVID-19 crisis?
Well, of course. And one of those things, you know, I live in New Mexico, and I'm here right now in my home state. And one of the things that, you know, look, this pandemic has laid bare all the disparities that we see in our communities. This pandemic has brought all those things to light. Some of the things I've talked about already. You know, we need to think about the folks who keep our communities running. Has anyone ever thought before the pandemic hit to walk into a grocery store and thank the grocery store workers, the people who are stocking our produce and frozen foods, to say thank you so much for the work that you do? Have we thought about how important it is to have fresh vegetables that we can buy every single day? These frontline workers, they deserve to have hazard pay. They deserve to have health care. So I feel like, you know, I was raised, my mother made sure that we spent a lot of time with my grandparents at Laguna when I was growing up. My grandmother didn't get running water until 1975. We used to have to haul water from the community spigot and take it back to the house to wash dishes, to take a bath, to do anything. And we learned at an early age to value, to conserve something as precious as water. And I feel like this pandemic has forced all of us to sort of think about how we were raised, think about how difficult things used to be for our parents and our grandparents, and take stock of how lucky we are. we all need to stick together to make sure that everybody can get past this terrible health crisis. And so I see that in Congress with my colleagues working very hard. We passed the HEROES Act 6 weeks ago already, and it's still sitting on the desk of Senator Mitch McConnell. It hasn't moved. You know, legislation that will help people to get past this crisis with their rent, with food stamps, with their education systems, with broadband internet. Those are the things that we need to focus on so that we can lift people up, so that we can lift each other up, and make sure that our communities can fare through this terrible time that we're having.
Well, thank you, Congresswoman, Congresswoman, for leading us off this morning. I think you have given us some very important messages that will be discussed in the panel. And we just really appreciate all that you do in the Congress. We thank you for your leadership, and we thank you for your leadership in the Tri-Caucus. I know that you're in the middle of appropriation season, so I know you might be able to join us for a little while, but if you have to depart, we really appreciate the moments that you give us. And with that, I'll turn it back over to Engy.
Thank you.
Wonderful. Thank you so much, Reta Jo. And thank you again, Congresswoman Haaland. What better way to start this convening but with your insightful remarks. We're truly grateful. So without further delay, let's jump right into our panel discussion. We'd like to start with Ponka We, who is a state representative from Kansas. We're really excited to have you with us today. Welcome, Ponka We. I want to give you an opportunity to add to or amplify any particular aspect of Congresswoman Haaland's message, particularly given your status as a local policymaker and a Native American woman.
Thank you, and it's so good to see everybody this morning. It's still morning here in Kansas. But yes, the Congresswoman touched a lot about some things that are important, like problems within our Indian Health Service system. We had problems before coronavirus, such as lack of equipment, resources, and funding. I also want to mention that Native Americans have some of the highest rates of chronic illnesses, such as diabetes and heart disease. And therefore, we're not equipped to deal with COVID-19. And this left a lot of tribes that had to tackle the virus with inadequate resources and help. And so also I want to mention that not only on the health side, but now we're dealing with this on an economic impact with the loss of revenue from businesses that helps the tribes be self-sufficient. Also, other problems align from this virus, such as there's language barriers. Some on reservations, there's isolation. On my reservation back home in Arizona, so I'm a member of the Tohono Nation, and I'm also a member of the Ponca tribe of Oklahoma. So on the Tohono Nation reservation, it is a huge reservation. It's probably the second largest in Arizona. And we are right down by the border, so our reservation crosses over into Mexico. And so one of the problems that we have is getting to health facilities. Sometimes it can take 3 hours, 4 hours to get to the hospital or to the clinics. And then when you get there, like I said, there's lack of resources, lack of health professionals. And so the waiting time to get seen is sometimes it can go on for 8 hours, 5 hours just to get seen. And also I want to mention that with the Native Americans, we have huge families. And so sometimes these extended families, we live together. We all live together in one home. So like the Congresswoman mentioned, if you don't have running water, you're not able to wash your hands all the time, like health professionals have been suggesting. Also, we're not able to practice social distancing as well. So these are some of the barriers that we're dealing with as Native American people. There's also been a lack of testing available. And like I said, with the language barrier, sometimes, like even on my reservation in Arizona, not everybody speaks English fluently. So there's a language barrier about what exactly this virus is and how important it is to seek help if you feel ill or sick. Because like I said, sometimes that's a 5-hour drive to the hospital or a 3-hour drive to the Indian Health Service hospitals. And you don't want to go in if you just feel like you have a cold. So there's a language barrier there as well. One of the things, besides getting more funding, that could help with, I believe, is, the Congresswoman mentioned data collection, also on the urban Native Americans as well. 70% of Native Americans live in urban areas. Like myself, I live in Wichita, Kansas, born and raised here, 3rd generation here in Kansas. And so there needs to be more data collected on us as well, so that we can help find solutions to these problems. Also, telemedicine would be helpful to reach the isolated areas to help everyone as well. I also talked to rural communities yesterday too, and they was talking about telemedicine as well. So it could not only help Native Americans that live in isolated areas on reservations, but it could also help our rural communities as well. And so lastly, I just want to end with, as Native American people, this isn't the first health crisis that we've been through. We've been through a lot as people, and we are in survivor mode right now. That's how we feel. Yes, we could have more funding, we could have more access to resources, but when you have a long history of battling with the federal government, you are in this survival mode to just try to live every day. And before COVID even happened, that's how we live as Native Americans, is just trying to survive. Now we're trying to survive through this health crisis. And I'm so thankful that we have Congresswoman Sharice Davids and Congresswoman Haaland and other Native American legislators across the country who can be a voice at that table to say, hey, what about the tribes? They should be included as well. I know on a state level, every time our governor has some kind of conference call or she has some kind of new information or data collection, I'm always asking that the 4 tribes of Kansas can be included as well on that information, because that's so important, because the tribes contribute so much to our state's revenue. So that's all I have right now, and so I'll pass it back to you, but thank you for giving me an opportunity. It's so good to see you all again, and thank you for the support over the years. I have a long relationship with the German Marshall Fund, and I appreciate this support.
Thank you, Ponka We. I look forward to returning to some of the themes that you highlighted during your remarks. Next, I'd like to turn to Dr. Russel Jeung, who joins us from San Francisco State University, where he is a professor and the chair of the Asian American program there. Dr. Jeung, as you know, we have seen a surge in anti-Asian discrimination and harassment, not only in California, but around the country in recent months. In your view, what is the scope of the problem? What factors are contributing to social hostilities? And what tactics do we need to effectively confront this?
Thank you, Angie, and good morning, everyone. I'd like to also thank the German Marshall Fund for sponsoring this event, and I'm appreciative of Congresswoman Haaland's remarks and Ponka We's remarks about the structural racism being exposed, that there's pre-existing conditions that have led to a greater health crisis for communities of color. But I'd actually like to talk about a particular racism that Asian Americans are facing at this moment. And she asked about the scope of the issue. And what's happened for Asian Americans is that not only are we fearing getting the pandemic and fearing exposing our elderly family members to the pandemic, but we've been scapegoated for being the source of the pandemic. So immediately when the epidemic came from Asia, I knew that Asians in the US would be scapegoated and then be met with interpersonal violence and racist policies. So we created this Stop AAPI Hate Center to track and document incidents of racism. And immediately we got hundreds of responses. So to date, since mid-March, we've had over 2,000 hate incidences reported. They come from 45 states, and it's a pervasive trend across the nation. 1 in 3 Asian Americans have already experienced racial discrimination during COVID-19. And the reason, and again, these aren't just like mere microaggressions, but they're actual virulent, hate-filled verbal attacks. They're acts of shunning where people purposely move away from us because they think we're disease carriers. In about 8% of the cases, we're experiencing civil rights violations. We don't get ride shares, people bar us from establishments, people mistreat us at the workplace. And about 8% are actual physical assaults, hate crimes, where people actually throw rocks and bottles at us, push and shove us. They hurl racial epithets, so we know they're hate crimes, they're racially motivated. And in the worst case scenario in Texas, a family was actually stabbed. They weren't even Chinese, they were refugees from Burma, but because they were perceived as being Chinese and because the assailant said, the coronavirus happens because of you, they were slashed in the head, a 2-year-old and a 6-year-old. So the scope of the issue is for at least for Asian Americans, sort of a commonplace, now pervasive fear of going out, especially when wearing a face mask in the beginning. And now if you don't wear a face mask, there's even greater fear that we're being attacked for being negligent. So for the Asian American community, we've reached an all-time high in hate crimes against Asian Americans during this pandemic. And if you ask, well, why now? Why? Part of it is, again, because China is a source of the disease, but it's really been exacerbated by political rhetoric that uses the term Chinese virus. Because what happens then, especially with President Trump's insistence of using that term, people associate the virus as being Chinese and Chinese people as having that virus. So that nexus, that association becomes part of people's implicit bias, becomes the way they automatically assume Asians are diseased, and it becomes part of the racial profiling process by which anybody who looks East Asian may be a disease carrier. And it's clear in our data, we have, again, over 2,000 incidents. Over about a third, people make remarks like, you know, go back home, the virus comes because of you. You people are disease-ridden and, you know, have weird eating habits. And so what Asian Americans are experiencing is a different kind of racism than maybe that Black Lives Matter is fighting against. We have a different racialization. Rather than being perceived the way maybe African Americans might be, we're perceived as outsiders to the US, as perpetual foreigners, a lot like how the Hispanic Latinx community is perceived, so that we don't belong. And whenever a disease occurs or when there's wartime with Asian enemies, then we're seen as being disloyal and need to be removed. So as I said, in history, we're met with interpersonal violence, and that's what's happening. And we're also met with racist policies. So just during the last month, we've had a ban, a mass immigration ban. There's been a ban on Chinese STEM students. And just this week, the administration ordered any international students have to return home if they're not taking classes here in the US. So you see the pattern continuing of an pandemic comes, Asians get attacked, violence, and with racist policies. What we need to do is actually really challenge this racist rhetoric, right? Words really matter, you know, jokes about the Kung flu. We see US-China relations becoming a presidential campaign issue. And the more they China bash politicians, the more people bash Chinese people and people who look Chinese. So our first policy recommendation is that it's fine to criticize governments, but you need to always support and love the people. And the people have to be really clear in distinguishing this is what the government does, but that doesn't give you license to attack the people. And but that's not what's happening. People are conflating, you know, the Chinese government with Chinese people. They're conflating a natural virus with thinking that the virus is caused by people. So for us in the Asian American community, foreign policy and foreign relations is really impacting our domestic racial position in the US. I have a lot more recommendations, but I'll stop now. So thanks.
Okay, thank you, Dr. Jeung. I look forward to returning to you to hear more of your recommendations. Next, we'd like to turn to Phil Rosenberg, who is the Director of Public Affairs with the Board of Deputies of British Jews. He joins us from the UK. Welcome, Phil. We know that the coronavirus crisis has in fact exacerbated anti-Semitism on both sides of the Atlantic. What are some of the causes and manifestations of that prejudice? And how do we push back against what seems to be only worsening anti-Semitism?
Well, good afternoon from London, everybody, and thank you so much to the GMF for inviting me to join this really august panel. I'm very honoured to be part of it. My general rule of thumb is that if Engy, Christel and Reta Jo ask me to do anything, I better do it. So here I am, but it's great to be joining old friends and new friends, Representative Haaland, Russel, Rashawn, but old friends too, like Mudidassar and Ponka We. And if I may say, Ponka We, a happy belated birthday for a couple of days ago. It's great to celebrate with you in terms of fighting racial injustice and prejudice together. So good to be with you all. As you heard from Engy, I'm going to speak about anti-Semitism, but I did just want to very briefly just express my complete solidarity and horror really at what we've been hearing both from Native American and Asian American friends about the prejudice they faced, and note that to come, I know the deeply painful things that we're going to hear about the racial prejudice we see against Black people on both sides of the Atlantic, and indeed Islamophobia, which remains a cancer in our societies. And I say that specifically with the fact in mind that on Saturday is the 25th anniversary of the genocide at Srebrenica against Bosnian Muslims, and it's shameful that these prejudices remain with us. In terms of the kind of manifestation of anti-Semitism during the coronavirus, a huge part of it is an age-old problem with anti-Semitic conspiracy theories, which have a long history. But just to kind of speak a bit about the manifestation, there have been really four main forms that this has taken. One, and a lot of this you can see on social media, one of the forms of anti-Semitism in the context of this is that the coronavirus is in fact fake. It's been invented by the Jews to particularly depress the economy. And you see that in some of the social media posts around this. Another one is that the coronavirus is real. It's not fake, it's real. But here it is Jews or Zionists or Israel, often used interchangeably, who have put this virus out there to kill people. And actually Israel is holding back the cure. And it's really a conspiracy to kill people. And it is, again, a Jewish conspiracy. A third kind of it is that Jews are spreaders. There have been anti-Semitic cartoons that have been on the internet looking at Jewish noses and saying, look, Jews are spreading it, look at their noses. There's been some particularly neo-Nazi uses of the term Jew flu to describe the coronavirus. And there's even been a kind of mood among some, particularly neo-Nazi white supremacist groups, celebrating Jewish deaths. There's been disproportionately high Jewish deaths as well as others, and talking in terms of the Holocaust, which is obviously extremely grim, and we see this kind of grim reality. Now, these kind of conspiracy theories have a long history. On the one hand, we have the age-old conspiracy theory of the blood libel, unfortunately invented in our own country in England in 1144 in Norwich. The idea that Jews, particularly around the festival of Passover, take the blood of young Christians to eat in the Passover crackers called matzahs. There's also the conspiracy theories that we saw in Tsarist Russia in 1903, the protocols of the Elders of Zion that claim to be the minutes of meetings of Jewish people who are, they claim, controlling the world, and everything bad that happens in the world is in fact related to a Jewish conspiracy. It is poisonous, it's hugely problematic, and it's there. And if I may say, in addition to coronavirus, and this is a very sensitive topic, but I raise it, is whilst we've seen so much important issues raised in terms of the Black Lives Matter movement, there have been extremists among the fringes who unfortunately tried to hijack that very noble cause to spread blame against the Jewish people, Zionists or Israel. There was this claim that Israel is behind the chokehold technique that led to George Floyd's murder. Untrue, but nonetheless circulating. We saw attacks on synagogues and shops with anti-Semitic graffiti in Paris. People at one of the Black Lives Matter demonstrations shouted "Sale Juif, dirty Jew." I think even from the platform at one of the demonstrations, and here there have been in some of the fringes of that movement anti-Jewish things shared, including one that led to a leading member of the Labour Party losing her shadow cabinet position. And obviously it's true that this is a tiny minority, and we are very clear that it is a tiny minority, but you can't fight racism with racism. And it's really important that we work together to suppress it, because like I said, every time something bad happens, the Jews are blamed. I think one of the things that I think is probably true for all of the prejudices we hear about is the contribution of social media as a problem. And here, I think our American friends can help us particularly. We see a real resistance by social media companies to take action on hate. The guidelines that they have are often very vague. They are very slow to take things down. We had, wasn't specifically related to coronavirus, but a bomb threat that Facebook said didn't violate their community standards against our organization. We had to remind them that a bomb threat against the organization probably does violate their community standards, and we've taken them to task. And I think it's important that we work, and we work as a coalition really, to make sure that they adopt standards on hateful speech, hateful conduct that really actually capture the nub of the kinds of hatred and prejudice that we're all speaking about, not generalities, but real specifics. We make sure that in each country, there are trained people who are monitoring it, because even across the English-speaking world, different things might mean different words might mean different things in different contexts. And it's really important that there are people in each country monitoring hate on behalf of the social media companies. And I think the model that Germany has gone with fines, massive fines for the failure of social media companies to fail to enforce this, is the right way to go. And we're pursuing all of these in the UK context in terms of the current online harms legislation. But obviously a lot of these companies are headquartered in America, and the more that can be done, and I know that a lot is being done, but the more that can be done to bear down on social media companies for their irresponsible activities, I think will help us all.
Thank you, Phil. I really appreciate your insights and incorporation of the role of social media in terms of intensifying social hostilities towards minority groups. I look forward to speaking to you more about that. Next, let's turn to Dr. Ray, who is a sociologist at the University of Maryland, as well as a governance fellow at the Brookings Institute. Welcome, Dr. Ray. What, in your view, has the coronavirus revealed about inequality in America? And how do we confront that going forward?
Yeah, I mean, first off, thank you for having me here. It's an honor to be here with you and others, the Congresswoman and others. Happy belated birthday, by the way, since I heard that. And I should also say, even though I'm going to primarily talk about, issues that are affecting Black Americans, but as a person who has a great grandmother who is a Cherokee Indian, as well as a wife who is working in Langley Park in Prince George's County, which is the hardest hit area in Prince George's County, which is 70% Spanish speaking. We see the ways that COVID-19 and this pandemic in particular is affecting a series of marginalized groups. There's one thing that I frequently have been saying and what I've been writing about at Brookings related to COVID-19. There's a saying, which is that when America catches a cold, Black people get the flu. Well, in 2020, when Americans catch COVID-19, Black people die. And we're obviously been seeing this spike for Latinos. We've obviously been seeing this spike for American Indians and the like. And what my research aims to highlight is the role that structural conditions play in the reason why we're seeing these gaps. I think it's a few things. Structural conditions undergird pre-existing health conditions. And we've kind of been hearing this throughout this conversation, that we're particularly dealing with two pandemics right now. Obviously COVID-19, but also structural racism that is baked into the very fabric and founding of our country, and something that we should be dealing with. But instead, during COVID-19, we had an opportunity to close the racial gap as it relates to health, wealth, and education. And we've done the exact opposite. And when I say we, primarily the federal administration. I think there have been some areas around the country that have tried to do a good job. But as we see COVID-19 ravaging through the South, it's become very clear that the impact that COVID-19 is having on a host of outcomes. When it comes to structural conditions, one question I always get is, why do we see certain groups being hit harder when it comes to COVID-19? Well, I think it's a few simple reasons that we've heard about. First, marginalized people live in underserved communities. What do I mean by underserved? These communities have a lack of healthy food options. One big thing I've been saying is people have been trying to blame Black people's behavior or genetics or something like that as why we see the gap. And of course, we just have to look around the world. There are certain parts on the continent of Africa that haven't hardly been hit hard at all. And then obviously in the United States, there are multiple groups being hit hard. So it's not necessarily as much about a specific racial group and genetics. It's more about the intersection between race and place. One big thing I've been saying is if you have $10 in your pocket and you're trying to feed a family of 4, you're going to go to the Whole Foods that doesn't exist in your neighborhood, or you're going to go to the McDonald's on the corner. Most people are going to choose that McDonald's. Those type of lack of access to resources also leads to a lack of recreational facilities, fewer green spaces, fewer parks, less lighting, less grocery stores. We also know that people live in densely populated areas. So physical distancing oftentimes becomes a privilege that people can enact. We also know that Blacks and Latinos, as well as American Indians, are more likely to be these new essential workers, people who are working as transit workers, people who are cashiers and baggers at grocery stores, nursing aides, people who work in cleaning services that further expose them. Even though Black people are only about 13% of the population, they represent anywhere from 20 to 30% of frontline workers, depending on the occupation, just being more exposed. And then we know that because of systemic racism, there is a lack of access to healthcare and a lack of healthcare utilization. On the lack of access, we know that if you're living in a predominantly Black or Latino neighborhood, that you're less likely to have a hospital nearby. You're less likely to have specialty clinics. You are less likely to have pharmacies. The pharmacies that do exist, they are oftentimes understocked. So if you're trying to get medication for COVID-19, all of a sudden there is a delay there. And then we know when people finally get to the hospital, that a recent study showed that Black people were 6 times more likely than whites to be turned away from COVID-19 testing. So here was an opportunity for us to close the gap. We've done the exact opposite. I think the CARES Act, which meant well, has actually become what Reverend Jesse Jackson and I have written about in Newsweek and Dr. Todd Yeary as the CAST Act. And what do I mean by that? There were a set of policies put forth, and it's not necessarily about the legislation that was passed. It oftentimes becomes about the implementation of it. We know as it relates to the Payment Protection Program from the Small Business Administration, that about 80 to 90% of Black, Latino, and women-owned small businesses were left out in the cold from that particular funding. What's the impact? The impact is that a recent study from Stanford just came out and showed that 40% of Black-owned small businesses have closed. Most of those small businesses are Black women-owned small businesses, which outside of Latino and Asian-owned small businesses has been some of the biggest growth that we've seen in small businesses over the past decade. We know that Blacks and Latinos are 3 times more likely to be dying from COVID-19. And when we put all these things together, it really highlights a 21st century redlining in a way in which we had an opportunity to actually close the racial gap as it relates to health, wealth, and education. Now, I think there are some ways in which we can move forward. I think in a lot of regards, we might still very much be behind the 8 ball, particularly some of the responses we've seen over the past month or so to education, to Affordable Care Act funding and the like. But the first big thing we need to do, we have to transform our colorblind approach to COVID-19 to a racial equity approach. Part of transforming it into a racial equity approach means we center the most marginalized among us. We center people who are living in underserved, low-income neighborhoods. We center people who are in tribal communities that don't have access to the resources they need. When we do that, all of a sudden things start to look drastically different. The first big thing we need to do is we need to collect demographic data. What do I mean by that? Well, we know that there are disparities as it relates to race, age, as it relates to gender even. We know that in particular, the group hardest hit are older minority men, just based on that. But we need to take an intersectional standpoint and collect more data to understand how pre-existing health conditions are manifesting, to understand how healthcare utilization is manifesting. We also need to get testing facilities in underserved communities. One big thing that I worked on with Congressman Jeffries that he scaled up in New York is to aim to get testing at churches. So we know that in New York that if you're living in the Bronx or if you're living in Brooklyn or Harlem, you had to go a pretty long way initially to try to get testing and treatment for COVID-19. They've tried to correct that, put testing facilities in places where people are. Now we have a new issue, which is related to not just the testing, but the speed at which people get their results. People aren't getting their results from COVID-19 for 7 to 10 days. By that time, they've already exposed their entire family. We've seen this with Mayor Keisha Lance Bottoms in Atlanta, who said, now pretty much everyone in my house has tested positive for COVID-19, and we would have done something different had that not necessarily been the case. We also know we need to do an auto correction when it comes to Small Business Administration funding. And finally, we need to take care of these frontline workers. What that means is give them hazard pay. It also means give them sick leave. It's important to provide sick leave. Why? Because if you don't have health care and you're making minimum wage, like let's take Nashville, Tennessee. I happen to grow up in Murfreesboro, Tennessee, about 30 minutes from Nashville. The minimum wage is under $10. Like you can't even afford an apartment in Nashville if you work 40 hours a week, even if you work 50 hours a week. And so part of what we have to do is give people a living wage, and we also need to give people paid sick leave. When you give them paid sick leave, they can take off from work, not worry about putting food on the table, go get testing, go get the treatment they need, and not expose the people they work with and the people in their household and in their communities.
Wonderful. Thank you so much, Dr. Ray, for those insightful recommendations and very practical. I look forward to returning to you to explore some of those themes in further depth. Next, I'd like to turn to Muddassar Ahmed, who is a former advisor to the British government and also a current fellow with the German Marshall Fund. Welcome, Muddassar. It's good to have you from the United Kingdom. Muddassar, what has the coronavirus revealed about anti-Muslim prejudice and discrimination? And what do we do about intensifying Islamophobia?
Well, thank you so much, Engy, for moderating this panel, and thank you to the German Marshall Fund for bringing these important voices together as we discuss something that's so common to many of our experiences. One of the problems with going last is that most of the points that I wanted to make about the structural ways that this virus has exposed inequality have already been addressed so comprehensively. And actually, it struck me how incredibly common so many of these experiences are across all these marginalized communities. And actually, it really struck me because a lot of the points that I wanted to make, Dr. Ray made and Russell made and Phil made, that actually it's brought out the worst instincts in many of the groups that have not liked our presence as colored people in our countries for a long time. And that includes the Muslim community. I mean, look, with the Muslim community in Britain, it's been a similar story to what many others have experienced in terms of racism, you know, and it's been incredible given the fact that the first 5 doctors to die from the coronavirus in Britain were of Muslim origin. And this was an issue that initially, you know, there was talk of racism within our National Health Service, at how certain doctors from certain backgrounds were being put in the front line, and others who were more senior from certain backgrounds weren't being given that same frontline role. But this quickly accelerated onto the virus taking hold in certain particular communities. And I grew up in a community that sadly was the hardest hit in Britain in terms of death rate. And we had to witness many of our family friends, uncles, and that and like come under strain from the virus. And sadly, at the same time, we were hearing reports of neo-Nazi groups. And I think there was something in the news just today, actually, about neo-Nazi groups specifically organizing to spread the virus in Muslim communities and Jewish communities. We were seeing memes going out again and again about how the Muslims are praying in secret, how Muslims are, the structure of their families lends itself to this sort of viral spread. I mean, numerous memes on the internet, on various different bodies that, you know, once these things will be studied afterwards, I think they'll be exposed for the pure racism that they were. I'm one of the things that I'm hopeful about is that having heard everyone's point of view in the way in how their communities are suffering under this virus, I'm quite hopeful that we're in a, it seems to me that the anger has boiled up. So, I mean, in my country, never before have a people been so angry against the government in living memory. The level of anger against this government's incompetence is so high, and dare I say, it's the same from what I can tell in the United States. And there is a moment in time here where people of color who have been suffering under inequality for so long, I think have the opportunity to organize, have the opportunity, especially in the United States, to create history and really undo a lot of the structural inequalities that have existed for a long time. And that will require, of course, many people in this panel and many of those that have spoken to organize in ways that the German Marshall Fund is helping to facilitate through conversations like these. But I think that there is a real, this anger, it really needs to be capitalized. And I think I have sensed, certainly in my circles in Britain, that that anger against the anti-Muslim rhetoric during COVID, or anger against the anti-Semitic rhetoric, anger against anti-Asian rhetoric is lending itself to organizing, political organizing, you know, in a way that I haven't seen before. So I think that this is something that is a positive that we should think about. And although I'm very, very upset at the disproportionate impact of COVID on my community in Britain, in Europe, and it saddens me every day to see how far-right groups are leveraging this, I do still think that there is a moment of opportunity here for people of color to turn the tables. Thank you.
Wonderful. So thank you all for your insights. We do have some questions from our audience, and so I do want to engage in a related question and answer period. And so Congresswoman Haaland, we're really grateful that you're able to stay with us. And so I'd like to actually begin with you. Our listeners are interested in knowing, particularly since you're situated in New Mexico, what initiatives, what policy initiatives and legislation do you think the national and transnational community would benefit from your New Mexican experience?
So one of the things that's become extremely clear to me, and one of the reasons why we in Congress fought really hard for tribes to have the funding for their communities, is that they know their communities inside and out. They know what they need. There's never a one solution fits all situation when in a terrible pandemic like this. I think it's important that communities are given the opportunities to decide what is best for them and how to approach this, something like this pandemic in a way that would best suit the needs of community members. So, it's one of the reasons why in Congress, in the HEROES Act, we fought to make sure that city governments and municipalities had funding so that they could approach this issue the way they saw fit. Why we fought for tribes to have the funding for each one of their tribes so that they could use the funding in the best way possible. So I think that, yes, we all need to come together, but we also have to recognize the unique intricacies of each one of our communities and how we can best, access the healthcare, the funding needs, the community support that we all need to get past something as devastating as this virus has become.
Wonderful. Thank you so much, Congresswoman. To follow up, and this is for Congresswoman Haaland, as well as Ponka We, Dr. Ray, and Muddassar, according to the research and data, the virus has in fact had a disproportionate impact on the communities that you've addressed, specifically with respect to mortality rates. We've seen a disproportionate rise in in fatalities in indigenous populations in both the African American and Latinx community, as well as in the Muslim community in parts of Europe. The UK and France spring to mind. And so our listeners are interested in hearing more about what you believe should be legislative priorities in terms of not only addressing those disproportionate mortality rates, but also the health disparities in Black and Brown communities. And so I'll open it up. You can, I don't know, Congresswoman, if you want to speak to that first, but again, this is an issue that has affected indigenous populations as well as the Muslim, African American, and Latinx communities on both sides of the Atlantic.
So I can just start with a couple things just for a very short while here. Since I've been so I was sworn into Congress during a government shutdown. The first 11 bills that the House passed were all bills to open up the government. In the meantime, communities all over the country were suffering. I remember volunteering at a place where we were giving away meals. Government workers could come in, show their ID, and get a meal for themselves and their families. Since that time, it seems like every day is a fight with this administration. They're always working to take away health care, break apart the Affordable Care Act. In the meantime, a state like Oklahoma voted to expand their Medicaid. So it's really clear that healthcare is something that has been used as a political tool for this president, and I think it's just hurting people outright. We need to protect healthcare above all, and things like Medicaid and children's health insurance and all of these things, SNAP benefits that is always getting cut as well. Everything that we that Congress has put in place over the many decades to give a safety net to families who are poor is being attacked. And so I think, that's a fight that I'm always willing to take on, but those are the things that we need to protect. I thank you, Dr. Ray, for talking about food deserts. People who don't have access to fresh food, that means they don't have access to healthy, vitamin-rich vegetables and fruits. We as a country, this is one of the largest inequities, is our healthcare and the opportunities for us to live healthy lives. And that's what we're fighting for every single day.
Wonderful, thank you. Ponka We, Dr. Ray, and Muddassar.
I would just like to add to that is that I'm a strong advocate here in Kansas for Medicaid expansion. We don't have a Medicaid expansion here in Kansas. We've tried numerous times, and with the last administration, Republican administration, he vetoed the bill, which we passed in both chambers for Medicaid expansion. And so that's the #1 concern here in the state of Kansas is healthcare, and making sure that everybody has access to adequate health care and that everybody is fitted under that umbrella. And I believe that Medicaid expansion could do that, but we just don't have the numbers to pass Medicaid expansion, unfortunately, this legislative session. But there's hope with the election coming up soon that will be on people's mind when they go to vote in November, is their health care. And hopefully people are paying attention of who supports Medicaid expansion and who doesn't support Medicaid expansion. Hopefully we can turn those numbers so next year we won't be caught in a bind like we are now. Thank you.
I mean, I agree with all the comments that's been made about this point. So I won't necessarily add to those 2 points. I think it's an additional thing that we could think about, and that's related to what happens with schools this fall. I mean, obviously that is upon us. If we had have actually properly social distanced and used PPE and done the things to protect workers and families, our numbers would be significantly lower, looking like certain countries in the EU, but instead we look drastically different, and we're a huge outlier in the United States, similar to Brazil and a couple of other places. I think as schools start to reopen, we need to ensure that resources are allocated. And of course, we've heard people on both sides of the aisle in the House of Representatives talk about providing funding for schools. Instead of removing funding from schools, we need to give schools more resources. And let me tell you why this is really important. We've talked about the health impacts, the disproportionate impact in the mortality rates. But the other thing that is simultaneously happening in these exact same neighborhoods, these food deserts, as the Congresswoman talked about, is that you have Black and brown and indigenous kids who were completely left out of schooling in the spring semester. There were a lot of places, including in Washington, D.C., that just called it quits and just shut down. And as schools start to reopen, what's going to happen is teachers are unfortunately going to be positive. There are going to be some kids who become positive. That's going to have a big impact on them. How are we going to ensure that kids can stay up to speed when it comes to schooling? I think that one of my colleagues, Dr. Nicole Turner-Lee, has a great example that Austin, Texas, and other places have implemented, which is if you have shutdowns with schools and they're just not going to go, what you need to do is you need to put school buses on the bus routes, equip them with Wi-Fi, and give all of the students a tablet or some sort of device to be able to keep up with their schooling. These are resources that should be allocated. So in addition to thinking about PPE in schools, because I don't know about you, I got two kids. I got an 8 and a 9-year-old, and they're pretty savvy at this point. But when they were 5 and 6, trying to tell them to put on a mask and not touch their face was just not going to happen. And then you got some teenagers trying to tell them the same thing. That's not going to happen with them either. So we need to be realistic. Part of being realistic is that we need to invest in what we believe in, and we need to invest in our future with our kids to ensure that they're not only protected when it comes to health, but that they also have access to educational resources so that they don't get further left behind.
Thank you, Dr. Ray. Muddassar and Dr. Jeung, if you also want to share your insights.
Yeah, sure. I mean, one of the things that strikes me here is that we have in common this problem of the narrative against our communities spinning out of control. And what I'd like to see in our countries, particularly something that we might have in common, is how we can start doing more, and this builds onto Phil's point, with social media companies, but also with governments, on actually dialing back that rhetoric. Because certainly in my government, you know, we don't have, we have, of course, we have problems with our health service, but not as, doesn't compare to some of the issues that you guys face in America. We have a nationalized health service here, thankfully. But one of the issues that we do have in the UK is this drift towards populism. And it started, you know, well before Brexit. Brexit is a continuation, and now COVID has exposed these structural populist protagonists out in the open. And this is very, very scary. And one of the things I'd like to look at and think, and like us to think about from a transatlantic perspective is hopefully, you know, I'm hopeful that a change in the political leadership in the United States will lend itself to the US actually playing more of a role globally in standing up for these things. I think that actually under the Obama administration, there was a lid on these things. You know, it wasn't perfect, but there was at least it was part of the discussion. It isn't even part of the discussion now, and I'm very worried as to where that could lead. So without being overtly partisan, I hope I haven't broken any rules here, but I do think that this is something we need to think about in the future. Thank you.
Wonderful, Dr. Jeung.
Yeah, I'd like to totally agree with that last comment. I think Americans' nationalist policies to build walls, to vilify immigrants and undocumented people is part of the healthcare crisis that we're facing now. So like I really support Medicaid expansion and universal healthcare. For the Asian American community, like the other communities of color, we're also dying at higher proportions than the national average. And I live in a neighborhood that has a high rates of undocumented people. And because unauthorized persons are denied public testing because they don't have access to healthcare, they have higher rates, right? Again, 1 in 7 Asian Americans are undocumented, but I'm actually in a Latino community. And so with the high rates of coronavirus in these undocumented communities, they're still working. They're the essential workers who have to work. They often have to work 2 jobs in crowded conditions, but then they also become the super spreaders. So as much as the American healthcare system that's tied to employment tries to protect American workers, as much as they try to be sheltered in place, if you have a large segment of the population who continue to go untested, who are asymptomatic but can be super spreaders, it does no good for those with healthcare to try to be sheltered in place. So in our experience, without providing universal healthcare, without providing more health equity, and I like Professor Ray's racial equity approach, we actually have to target the populations that are actually higher infected in order to prevent the spread, right? It just makes total sense. And to try to propose policies like, let's open up the schools, let's open up the economy, absolutely makes no sense in terms of public health. And so what we need to do is, again, provide healthcare to all segments of our community, whether they're documented or not, and to address it in a cooperative way rather than a, let's just ensure that everybody has their rights to wear, if they want to wear masks or not.
Thank you, Dr. Jeung. To build upon that response, and also to return to an argument that you made, Dr. Ray, regarding the preference for a racially equitable approach rather than a colorblind approach to the coronavirus. There was an article this morning that was published in the New York Times exposing a debate that's currently occurring regarding the possibility of prioritizing vaccines for brown and Black communities once a vaccine is actually found, whether or not the federal government should prioritize these disproportionately impacted communities with respect to access to a vaccine prior to other segments of the population. Of course, it's evoking a little bit of controversy. And of course, you know, Muddassar, while you're on the other side of the Atlantic, I think this is also relevant in light of what the research data has shown with respect to the Muslim community, again, in the UK and other parts of Europe. And I wanted to get your insights in light of the arguments that you made. What do you think of that proposal?
So I think that it's a viable proposal, but this is the, I think the more important point is when we center race equity, we not only think about, you know, it's important to not only think about who gets priority over another group. I think when we center race equity, we're saying that people should get the same opportunity as other groups, not necessarily be above other groups. So what's key here is dealing with distrust when it comes to healthcare. So even if, say, someone just decides, okay, we're going to give the vaccine first to the most vulnerable among us, which I view a way to do it rather than exactly prioritizing it in regards to race, we prioritize it in regards to who's exposed to COVID-19, frontline workers, people living in densely populated areas. And you know what, when you do that, you end up with a disproportionate number of Black and brown people who are going to get access to the vaccine because they're more exposed. That's an example of centering race equity without necessarily just saying that one group gets it over another, because this is why it's key. Because we know that early on with the antibody testing, we also know as the vaccine is coming up, that wealthy people, particularly people who are affluent and white, are more likely to get access to the vaccine early. So part of what they're trying to say is an auto correction to that. But what I'm really worried about is the fact that even if the vaccine is available, that you're going to have a lot of Black and brown people who simply are not going to take it because they mistrust healthcare and they have rational reasons for doing so, not only historically related to the Tuskegee syphilis study or the Guatemalan study, which was similar as it relates to syphilis, but also in regards to Henrietta Lacks and the HeLa cells that was hidden from her family that's been used to cure a whole bunch of diseases. And then more recently, the fact that a whole bunch of people, particularly Black people, have been turned away from COVID-19 testing. So we need to center race equity to address the medical mistrust gap. And a way to do that is oftentimes is to center these resources in predominantly Black and brown communities. And when we do that, if we already have testing centers set up, We already have triage set up. That trust is built locally because you have people in local communities who are doing the testing and the triage. You're going to be more likely to get people to buy into the vaccine, because from a historical standpoint, marginalized groups in the United States have every rational reason to be skeptical of what a vaccine might mean, particularly when we have French physicians saying, oh, well, let's just go test on Africans and let's just see what happens. I mean, these are the types of responses that happen that prevent us from moving forward and creating health equity.
Wonderful. Others, did you want to, Muddassar, Dr. Jeung, Ponka We? Any thoughts about whether or not the federal government should prioritize access to vaccines for some communities over others? Okay, I'll follow up with Dr. Jeung. You had publicly called for government accountability with respect to its response to the upsurge in anti-Asian racism. What does that look like in your view? And what are the potential social, economic, and political costs of its absence?
Well, it is costly to take that racial equity approach that Professor Ray is talking about, but and we recognize the budget constraints that most states are going through now because of the economy and the state of the economy. But what we're recommending is that we, at least in California, we need a racial bias task force, that we need a comprehensive approach to address the disparities rather than piecemeal approaches or one-off attempts to cater to one group. Rather, what we're seeing is that the racial bias against Asian American is at several different kinds of sites and take different forms. So we're getting harassed at schools. So state agencies and school districts have to ensure that schools are sanctuaries from racism. We're getting attacked on public transit. So transit authorities need to take proactive steps. We're getting harassed and attacked at the workplace. So the Department of Fair Housing and Employment need to take proactive steps. So you can see that the racism that's being exposed by COVID-19 is pervasive and showing up at all these different sites, so that every state agency needs to take a proactive approach. Because we're just a small advocacy group at Stop AAPI Hate, we need from the top a statewide coordinating agency that could make racial bias its top priority, and to both direct agency heads and the managers to take it on as an issue, but also to work with community members to develop positive policy approaches. So it will be costly, but it's, again, reorienting the state government to be more proactive, to recognize this pandemic is hitting, and particularly communities of color, in more devastating ways. And so we need to highlight that issue and to deal with it in a more comprehensive way.
Thank you, Dr. Jeung. To follow up on that, during Dr. Jung's initial presentation, he highlighted the role of political rhetoric in contributing to the upsurge of anti-Asian racism. And it's hard to ignore the fact that this is also true of other minority community groups, such as the Muslim community, such as the African community, such as the Jewish community as well. And I wonder, in your view, Phil, Muddassar, and Dr. Ray, what does accountability look like in terms of that volatile political rhetoric that contributes to discrimination and hate crimes against vulnerable, marginalized populations? Is it simply showing up and voting these individuals out of office, or is there something more that can be done?
Thank you very much indeed. Well, certainly voting is a key part of it, and where we see politicians who use direct or dog whistle type racism to fuel their political ambitions, there's the opportunity to highlight that and to try and get people to vote against it. But the highlighting of it is important, and particularly the challenge of being a minority is that you don't necessarily know always, you can't guarantee always that the majority communities are with you. So there's a a really important job for all minorities to do, both individually and collectively, to make sure that people understand the different forms of racism and how they manifest. So as much as we would like the state to always be supporting us, and we would hope that generally speaking it would, where it's not doing that or not doing it properly, we have to take advantage of the media at our hand. And here's where, for example, social media can give us a voice that we might not otherwise have. I also think it's really important to find ways of bringing people to justice, either within political structures, if there are disciplinary processes within political parties, or sometimes even law enforcement where laws are broken. We have seen, and having criticised social media, I'm not only criticising them. There are things that they have done well. There have been times when politicians have said things and that have been clearly harmful, and certain social media companies have highlighted that to be the fact. So there are things that we can do. There are things that we're clearly achieving. And we would hope that allies across the majority communities would be with us, but we do need to do the work of bringing those allies on board, making them understand the problems, and helping to empower them to help us.
I'd agree with a lot of what Phil said. Throughout the course of my career and activism, I've constantly encouraged people to take action at the ballot box, to raise their voice in the media, to organize, to protest, to campaign. But these days I'm looking at the way the world is, and just like you do need coordinated international action against a pandemic, I think you need coordinated action internationally against racism. And I would love to see more coordinated international. I want to see this stuff go into international treaties. I want to see this stuff be part of high-level conversations with teeth. And I want to see a lot more, arbitrations on these issues. Like I really think, for instance, Britain is going to want to negotiate a free trade agreement with the United States fairly soon post-Brexit. Well, I'd love to see a conversation around racism and equity built into these sorts of conversations. Now, maybe the current occupant of the White House isn't particularly interested in pursuing that, but again, I have faith in the American people and its institutions, and I think that if America decides that it wants to pursue a policy of inclusiveness around the world, I think it will also go a long way towards dispelling the notion that America is in some sort of decline.
Wonderful. Dr. Ray, did you also want to address this?
Yeah, sure. I agree with what's been said. It's interesting. I'm always cautiously optimistic about moving forward in the United States and to address racial inequality for the reasons that I laid out. But I think that there have been a lot of things that's happened over the past few months. I think in particular, the murder of George Floyd has created another racial awakening, not just in the US, but around the world, to police violence, but also further raising awareness about these two pandemics and the disproportionate impact of COVID-19. People's attitudes about race have drastically shifted, so much so that over 75% of whites, including a sizable percentage of Republicans in the US, now are starting to understand that systemic racism is real. Doesn't mean they understand what systemic racism is. Those are oftentimes two different things. With that being said, to the point of what we just heard, what we have to do is now it's time to put in the work to understand what systemic racism is, understand how it impacts our lives. And I know at Brookings, one thing we did, we launched a new writing series called How We Rise. We would welcome anything written from all of you, so please consider us for various outlets. But part of it is using these writings to address systemic racism. And I think moving forward, one big thing that we have to do in looking at our country, and while I'm appreciative of symbolic symbols of Confederate flags and statues come down, look, I'm from Tennessee. I've seen so many Confederate flags. I could talk about that. But these symbols, changing names of stuff doesn't change the fact that Black and brown people are dying from COVID, and that Black and brown people are still more likely to die from police violence. Nothing has changed with that. So what we need for our elected officials to do at the federal level and the local level is to pass legislation, particularly police reform legislation, that deals with the fact that people can enact violence on someone else and in their lives. And the police reform stalemate that's happening in Washington, D.C. right now speaks to how things never happen. Like, while I applaud the George Floyd Justice and Policing Act that the House of Representatives passed, it's a very strong piece of legislation. They passed it on Tamir Rice's 18th birthday. That was a lot of symbolism. The problem is that the Senate might not even bring it up. So you have a lot of people throughout the country thinking this policy is a thing when it's not. And so part of what we have to do is not just look at who's in the White House. We have to look at down ballots. And what we have to do is hold our local officials accountable. We have to get involved. We have to become what I call a racial equity broker. That's where we really broker and change the policies, rules, regulations, and procedures that govern us. That includes the schools our kids go to, the neighborhoods we live in, and the houses of worship that we go to. And I think all of us have a role to play in moving our society forward.
Wonderful. Thank you so much. Well, we are approaching the end of the program, and I do want to give each of you an opportunity to share any closing remarks, as well as to consider the following question. In your view, in what ways and on what issues are there opportunities for diverse communities to work together, either in a local, national, or transnational context to achieve equality in a post-pandemic world? So Ponka, why don't we start with you?
Thank you. One of the things I forgot to mention in my presentation is to talk about what the tribes, since we've had lack of funding, lack of help from the government. One of the things that the tribal leaders have done, but some tribes have gotten pushback from their governors, state leaders, is imposing stay-at-home orders. They've done that. Strict curfews across reservations and checkpoints on the reservations, all to prevent the spread of the virus. Unfortunately, like in South Dakota, the governor has requested that those checkpoints be taken down, despite having lack of funding or any kind of help or aid to the tribes. And so I'm very thankful for the Doctor Without Borders. They've been assisting some of the tribes across the Southwest. Also, other countries have stepped forward, and I appreciate that and very thankful for that have been helping the Native American tribes here in the United States. So, we have other countries helping us, but yet, our federal government is lacking the help to the Native American tribes and nations. One of the things that I think we can do to work together is also to support each other. And I wanted to ask Dr. Jeung about, you talked about supporting, the Chinese community. What's some of the ways that we could support, the Chinese community? And when the Black Lives Matter, when the protests, we all supported each other. We try to support each other there. So I think that's important, is that we have to support each other, because a lot of times people are waking up right now and they're thinking, wow, this has been happening. And yes, we can answer that because we've been on the other side. We've dealt with this our whole life, as far as we do need police reform. A lot of people are thinking, wow, that's crazy. But, when I seen that video, I see my brothers, I seen my nephews. That could have been me there. In fact, things have happened to me where I've been driving home from the Capitol dark and I've been pulled over and just harassed. So I can say that I've honestly experienced that. And when I get pulled over every time, I'm scared, and I don't care who I am, or it can happen to anybody. That's what I'm trying to say. And so there does need to be some kind of police reform. And I'm glad that my colleagues have, we've all are trying to work together. We have a quad caucus too in Kansas that's comprised of the very different ethnic groups there at the Capitol. And we're going to try to bring some of these legislation forward in the next legislative session in January to try to address these issues. But if anybody has any kind of, if they hear something in their states that they're doing it might be helpful in Kansas too. So feel free to share that information and let me know how I can help. I'm a voice for all people, even though, you know, I live in an undocumented community as well. So I'm scared for our workers that are undocumented workers that are working like in our meat packing plants. I live in an agriculture state, and so I'm trying to work together with the unions to make sure that they're taken care of and that they're safe. So I cover a wide variety of communities. So please feel free to add me on Facebook, and you know, let's continue to keep the conversation going and try to support each other during these difficult times. Thank you.
Thank you, Ponka We. Dr. Jeung, closing remarks?
Well, thank you for this opportunity. And I'm going to give a little rambly answer. You know, I think about what it looks like to dismantle white supremacy and to what would come afterwards. And I'm afraid, I know abused people become abusers, hurt people become hurters, oppressed people become oppressors. And we need to avoid, after the dismantling of white supremacy, new forms of oppression, right? And so I guess for me, the first step is a truth and reconciliation process to actually to deal with the trauma, to deal with the hurt, to deal with the injustices that America has been built on, right? If we want to reimagine our healthcare system, our justice system, our educational system after the pandemic, we have to actually get rid of the foundations around which I think America has been built on. It's been built on slavery and the genocide of Native Americans, right? And that's built into the fabric, it's built into our institutions. And that's why you see the structural racism continuing to this day. So until we deal with our historical roots of racism, I'm afraid it's going to just be perpetuated, even if we begin to dismantle white supremacy. Part of, for me, what that looks like is that Asian Americans at this moment don't know where we fit in because we're cast as outsiders. We don't fit in that white-black dynamic. And so we're always trying to want to belong to America, but not fully belonging. And I'm saying at this moment, I don't really want to belong to America as it is now, right? It is so broken, it is so racist, it is so unjust. And so to imagine America that I would want to belong to as an Asian American, to imagine new systems after the pandemic, I think what we need to do, and what I would appreciate from the panelists here, are new virtues around which America and can be built on, and how we could have transnational relations with. New virtues that aren't based on slavery and genocide, on capitalism necessarily, but new virtues based on, for me, understanding indigenous communities' values, understanding African and Latinx values, reclaiming Asian values. And so what I dream of is having a new America that's sort of built on a sort of a new system of virtues that incorporates the multiracial, multicultural nature that it is now.
Wonderful. That's very powerful. Thank you, Dr. Jeung. Phil, any closing remarks?
Yes, couple. Thank you very much. And I must say, I really associate with what Russell says about not knowing whether you're white or black. Whole shelves of books have been written on whether Jews are white or black, or what we are exactly. But we certainly are alien another and treated as such. And I think that there's probably a rich conversation to be had about that. If I think about the things that I think we can contribute together and some of the things I think maybe we can offer and some of our learnings over the last few months, one of the things is organization, one of them is advocacy, and one of them is unity. In terms of organization, one of the things that we have learned over centuries as a minority, or millennia as a minority in different places, is you can't always rely on the government much as you might want to. So as much as possible, trying to develop self-reliance. And one of the things, for example, we did was we started collecting data on Jewish deaths from COVID-19 ourselves. And we discovered that Jews were dying at 3 times the rate of the wider society, because, you know, we knew government would be late to do this, and we wanted to make sure that we knew what was going on. We could get the messages out to the parts of our community, and it's something maybe that we can share how we did that. advocacy is extremely important. And earlier, you know, we spoke about how in election time we can deal with this issue. In the last general election, the Jewish community, I think, was quite successful in raising how, particularly in the Labour Party, there was widespread anti-Semitism and making that a political issue. And it was raised in areas across the country by people who were not Jewish and in areas where there were very few Jews, because people felt so offended by it, because we ran this national education campaign through the media, through social media, which really resonated with people, and sharing some of those techniques to work out how you speak to people who don't share that identity, but can associate with that. Because a lot of people are against injustice and prejudice as long as they can understand it. And as Rashawn was saying, that's sometimes the problem, helping them to understand. And then the point of unity. And I don't mean by that, you know, heaven forbid, you know, all lives matter or all forms of racism, those kinds of conversation. I think we have to recognize the specificity and the harm of each different form of racism, but each lean in to support our friends and colleagues of different backgrounds when they come under attack, and take, you know, the leadership of those different communities and say, as we look at the moment in terms of prejudice against Black people, how can we as communities support Black communities on both sides of the Atlantic? How can we add our voice? How can we empower people? How can we use our connections to help make those changes? Because, you know, we should be trying to raise the tide for everyone. And I think if we can work together, we can have that positive impact.
Excellent. Thank you so much. That was incredibly helpful. Dr. Ray.
I mean, I just echo what's been said. I mean, thank you for having me. I mean, when I think about a pathway to move forward, and I mean, we essentially heard what would it mean to dismantle white supremacy? I mean, I think that's the main thing. And I tend to think that in the United States, the only proper way to fully atone for American Indian genocide and slavery, as well as in a global context, colonization, is through reparations. And that reparations process does include finances, but it also includes a truth and reconciliation process, as we heard. And there's no way to move forward without both of those things coming together. And I think that we all have a role to play in this particular process. And so as we move forward, and I think as there continues to be an emphasis on how do we fully close the racial gap, I think, again, we missed a lot of opportunities with COVID-19, and we're going to see inequalities continue to exacerbate. But with that being said, I think we could push for policies. And I think oftentimes at the local and state level, similar to wide sweeping legislation we've seen before, obviously going back to the 50s and 60s with Brown versus Board of Education and the Civil Rights Act, a lot of that work started at the local and state level and scaled up to the federal level. I think we're seeing that with policing. I think something big will happen with that, but we need to address wealth, and we need to really address the hearts and minds of people and the healing that needs to go on. And I think a truth and reconciliation process, to Dr. Young's point, can really help address that.
Wonderful. Thank you so much, Dr. Ray. Muddassar, you have the last word.
Thank you. Well, another problem with going last is all the best points have been made, but I'm going to try to break them down. I agree with practically everything that everybody else has said, but there's a couple of points I want to add. One of the things that we need to do on both sides of the Atlantic is investigate what exactly went wrong on a number of these issues. And I mean official government investigations. It's very clear that the Muslim community in the UK was heavily hard hit, and Muslims in the UK, of course, come in all different shapes and sizes, right? Like, you know, Pakistani Muslims, Somali Muslims, and all other sorts of Muslims. The UK government does have data that shows that we've been harder hit, and some sort of investigation would be good. Now, thinking in terms of how we can support each other, I think one of the things that we need to think about, I would love to see a few big ideas here. There is a moment of genuine opportunity and anger. I have never seen such an outpouring of anger as I've seen over the past few months. And I think we need to work with this anger to make sure it doesn't spin out of control. And this is where the truth and reconciliation piece comes into it. But at the same time, we need to see what political capital can be generated to do things like, I'd love to see, for instance, we're talking on the German Marshall Fund platform. I'd love to see a Marshall Plan for racial equity across Europe. I'd love to see, you know, a celebration of diversity, and also an understanding that diversity is going to make our societies far more compelling, competitive, and advantageous as the rest of the world is going down a far more authoritarian route. And I think this is an important point for us to press home in the debates that we have. So I'd love to see some of these big ideas as ways that we can work together. Thanks.
Thank you. Critical insights, Muddassar, we appreciate them. I want to take a moment to thank each of our panelists for devoting your time and participating in this webinar. It wouldn't have been possible without you, so thank you for carving out that time. It's a testament to your dedication to these issues during a challenging and unprecedented time for all of us on both sides of the Atlantic. And thank you to our listeners for tuning in and staying and listening. For those of you who are interested, a program recording will be made available on the German Marshall Fund's YouTube channel. So please do look out for that. And we look forward to hosting you again on a future webinar. So thank you, stay safe and healthy.
And thanks to you, Engy.
Thank you.